everybody, this is Nin and welcome back to Dissociative. This is a channel that tries to destigmatize dissociative identity disorder and other mental health illnesses. We get a lot of questions and we see a lot of people asking questions about this generally in the community, saying, how can I tell if somebody is faking having dissociative identity disorder? You may not get the answers you're expecting. Stay tuned, see you in a bit. Hi, so where even to start with this? First of all, it's really not unusual for people with DID or OSDD, which is otherwise specified dissociative disorder, to feel like they're faking, regardless of whether you have a genuine diagnosis by a professional or if you're self-diagnosed. It's very common to feel as though I must be making this up. There is no possible way that I could have DID or OSDD. This is normal. It doesn't matter how obvious the symptoms are or how subtle. It doesn't matter how overt your system is or how, again, subtle. Systems are very, very, very diverse. Everybody's DID will present differently. So just because somebody in your life who has DID or says that they have DID doesn't have symptoms that look exactly the same as the DID or OSDD YouTubers you may watch does not mean that they're faking. DID is a very unique disorder to each individual system who has it. DID is a coping mechanism. It's a trauma-related disorder. That means that it will be different based on what every child needed. No two children will have been the same. Everybody's brain works differently. Everybody will have had different experiences, regardless of whether those experiences were of different traumas, the same traumas, different environments. No two people, even if they experienced the same trauma, will have exactly the same coping mechanism. Everybody's brain works differently. They will have different connections to their primary caregivers. They will have had different experiences, even twins. They will have had different dreams, nightmares, different conversations, different people that they've met under different circumstances, different views of the world, even if they experience the very same traumas. This means that as DID develops, it is a dissociative coping mechanism. It is created to try and keep that child safe from the awareness of the trauma that they are experiencing. In order to develop DID, you need to have three things: the ability to dissociate to a high level inherently from birth, experiencing repeated or severe traumas over an extended period of time. As DID is a disorder that is developed in childhood, these traumas must have been experienced before the personality fully integrates into one in normal development, which means before the ages of around 7 to 9, as these traumas disrupt the normal integration of a single personality and create amnesic walls going up, which means that the different alters, the different parts of the consciousness, are separated off by memory loss in order to keep the system safe from the awareness and the backlash, the emotions, everything to do with the trauma, so that they can live a normal life. The final thing that is necessary in order to develop DID as a child is having unstable or disorganized attachments to the primary caregiver or caregivers. This means that the brain does not understand or does not find it easy to connect with the people or person who is supposed to be keeping them safe. Therefore, everything is turned inwards and they do not have a successful or healthy way of expressing their emotions or asking for help. There are multiple types of disorganized attachments, and if you are interested in that, we recommend having a look at Bowlby's attachment theories. So that will tell you pretty much everything you need to know about the different types of disorganized attachment that you can develop during childhood. You can have DID and not remember your trauma, especially if you are the host. This is normal. DID is built to protect you from the knowledge of that trauma. But in order to have DID or OSDD, you will have experienced repeated childhood trauma. If you haven't, then you do not have DID or OSDD. This is part of the diagnostic criteria and also part of what makes DID and OSDD what it is, a trauma disorder. A dissociative neurodevelopmental trauma-related disorder. Because of the very nature of DID, it is very normal for people to think that they're faking, as I mentioned earlier. It is part of how DID works and manifests in the brain for the brain to immediately doubt anything that is presented to it, saying this is traumatic, this was abuse in some situations, for example. And even when you are confronted with maybe somebody telling you, hey, you have DID, or you have a diagnosis, or even alters reaching out to you, making notes, leaving voice messages, things that can't otherwise be explained. It is part of the way your brain has learned to cope with the world around you and the childhood that you experienced, for it to say, no, not possible, absolutely can't be happening to me, no, we're going to dissociate from this, because that is how your brain has learned to keep you safe. It is very normal to question the validity of your diagnosis and your validity of your existence in your own system, even if you know deep down that you have it, even if professionals have told you that you have it. It is part of the way your brain is trying to keep you safe. DID is supposed to be a covert coping mechanism. You're not supposed to know that you have DID until it's time. For some people, this can be years and years and years and years and years in the future. I know some people who didn't find out that they had DID until they were in their 70s. 70s. Others find out in their 20s, 30s, 40s, whenever, some even in their teenage years. A lot of the time this can be because you may have moved away from the area of the trauma, or perhaps if it was caused by individual people being removed from that situation. A lot of the times the system who has been created, developed essentially by your brain to keep you safe from those people or that environment, now they don't have that job to do anymore. Everything's different and your brain has never experienced that before. Therefore, these alters may start acting up or reaching out for help, trying to figure out, okay, well, what do I do with myself now? Am I deserving of a life too? Of course you're deserving of your own life. Yes, you are. But you all have to work together as a system. And it's usually when things like this happen that people start to find out something's not quite right with me. Or the whole system will go into a meltdown, and then usually you'll end up in some facility, or you'll have a doctor telling you something's not right here. Something different from the ordinary. The average time that it takes to get diagnosed with DID is 7 years of already being in the mental health care system, because it is such a stigmatized disorder. So many people in the industry will question its validity or aren't trained on how to notice or diagnose or treat it. Even though it is in the ICD and the DSM, it is recognized worldwide as a valid disorder with a known cause and lots of treatment guidelines. If you are a professional and you're interested in how to treat DID, we recommend having a look at the treatment guidelines, which you can find down below. And therefore, it can take a very long time to get diagnosed with the correct diagnosis. So just because you've met someone and they don't have a diagnosis yet, that does not mean they are faking. It is very difficult to get a diagnosis of DID. It is very difficult to find people who are qualified to help you deal with your trauma and the reality of having a brain that is developed as fragmented. It is a very complex disorder. And as I said, it will develop differently for every single person. Just because the person that you've met or seen, whether online or in person, doesn't have symptoms that necessarily line up completely exactly the same as your favorite DID YouTubers, for example, that does not mean that they're faking. For example, my switches will look very different from, let's say, Team Pinata's switches or Multiplicity and Me switches or anybody else that you may find online, because we are different systems. Our brains are different. We work in different ways. Also, a lot of people do base validity on switches. So, for example, we had a comment once saying, I know that somebody who catches a bus with me is faking their DID because they switch like that really fast. It can be a blink and then a different person. Whereas the switches I've seen through your videos, our videos, are generally much longer and more dissociated. If you do watch our videos and you watch them from start to the end, you'll see lots of different types of switches. You'll see very, very, very long dissociated switches where we're having a really hard time sort of making that crossover from one person being in front to the other person being in front. You will see switches that are triggered literally like that, blink of an eye or a couple of blinks, and the next person will be there. It really does depend on the circumstances, the situation that you are in, how comfortable you are in your environment and the people around you. how difficult the communication is between the two alters who are trying to switch. If you have better communication with two alters, generally the switching between them will be easier, as there is less of an amnesic block between them, which means that it's easier for the brain to essentially click over the gears. Also, if it's a triggered situation, switches may be very, very fast, as that is your brain clicking over into fight, flight, fawn, freeze response and trying to, boom, get it sorted, stay safe. Switches will look different within a system itself and between different systems. It really depends on how your brain works, how your brain developed your DID, where you came from, and the experiences you are in at that moment. This also includes your communication between alters in your system, how far along in your healing journey you are. It can be a huge range of different external and internal factors that affect the way that your symptoms present. So please, just because somebody with DID doesn't perfectly match up with other examples of DID you've seen, does not mean that their DID then isn't valid. There are so many different ways and different types of having DID. Some systems are very, very overt, in which case their DID can look very, very obvious. They may have alters that are very, very, very different from one another, with very different voices and handwriting and extremely unique and big characteristics between them. And then there are more subtle covert systems. It's more common to be more subtle and covert than it is to be overt, but both are equally as valid. Some systems you will not be able to tell there has been a switch. Generally, if a system especially is out and they do not want you to know that they're switched, you will not know. This system is built to go under the radar. And again, all these things will change depending on how comfortable this person is about having their DID, and especially about having their DID in front of you. So for example, the way we present as a system is very different in the real world outside of this than it would be in front of a camera. When we are in our safe space, we know that whatever we're not comfortable showing, we can edit out later. I'm talking in my very safe home to a camera right now. And through that, I'm talking to you. But this is an environment where I can control what happens. Whereas in the real world, it probably wouldn't look as... I probably wouldn't be as confident as this in talking about my DID. And I certainly wouldn't be as confident in showing my switches. So for the people who try and ask, okay, cool, that's all fine. People with DID are valid, absolutely. But how do I tell if someone's faking? I mean this with all the respect in the world. But really, it is none of your business. It is not any of your business to try and tell whether somebody is faking their disorder. Denial in DID is already a very, very, very strong issue when it comes to trying to accept and validate yourself and your system. Having somebody believe you is so overwhelmingly life-changing. So what if they are faking? It'll come to light eventually. But what if they're not? What if they're not? You trying to understand them, taking their word at face value and getting to know them better could completely change their life. It is extremely difficult to fake DID, and I'm not saying that people don't, because I'm sure some people do. There have even been people online who have pretended to have DID and then have come out a few years down the line and was like, I was faking it. But this is a disorder that affects every part of your life. If you were faking this, you'd have to remember exactly what you have amnesia for all these different people, every single way that they hold their body differently, their voice differently, what they know, what they don't know, their connections between everybody else within their system and everybody in the outside world, how they react to certain stimuli and trauma. It would be exhausting to try and pretend to have that all day, every day. Having DID on its own is exhausting. It does not stop. There is always something. If somebody came up to you and told you that they had an autoimmune disease, or they have cancer, or they have epilepsy, the first thing you think wouldn't be, oh, well, how do I find out if they're faking? You'd think, oh, okay, they've said they've got this, therefore until I'm proved otherwise, of course I'm going to believe them. So many people jump to thinking, oh, well, maybe they're faking when it comes to DID and OSDD, because so many people think that it's such a rare disorder. DID affects between 1% and 3% of the population. That means it is more common than schizophrenia, just as common as bulimia, and exactly the same percentage of the population has red hair as will have DID. Think about how many people you've seen with red hair. It is exactly the same percentage of people who have DID. It is not as rare as it's made out to be. So please, if somebody tells you they have DID, or somebody puts themselves out there, this is a very difficult disorder to be open about. Just having DID in itself can be a vulnerable thing. By telling somebody you have DID or OSDD, you're saying, I had an extremely traumatic childhood. I have amnesia. It is somebody opening up their heart and their past to you just by saying, I have DID. Because all that information is part of how it's made, of how we developed to be who we are. Please don't jump straight to the conclusion that they must be faking. Don't try and squirrel or ask loads and loads of 21 questions as soon as somebody comes out and tells you that they may have DID. You probably don't know how difficult that actually is. They're putting everything on the line for you. Sure, if it comes to light that some things aren't quite adding up, then maybe look into it further. But please don't immediately jump to conclusions. Take them at their word. We always try and believe the best in people until proved otherwise. Because otherwise, what a life to live. Thinking the worst of everybody immediately. It is a terrible world sometimes. There are horrible things that happen. We're no stranger to that. But we have to believe that there is some good in the world. Try to focus on those things rather than the negatives. And know that every person with DID or OSDD will be different. That doesn't mean that they're fake. Just because you think that you're fake, doesn't mean it's true. It's your brain trying to protect you. It's normal. It's normal and it's valid, but you are real and we see you. A lot of people have said, if you feel like you're faking and you're worried about that, if somebody was actually faking, you'd know you were faking. You wouldn't be worried about, oh my God, am I faking? If you were faking, you would know. So having these intrusive thoughts or these feelings of, oh God, what if I really am faking? What if this is all in my head? This is all, I'm subconsciously making this up. If you were faking, you wouldn't be feeling like that. Don't worry. So I hope that this has answered some of your questions, but at the end of the day, my point is this. It is very important to create communities between yourself and the people who come into your life. As long as they are safe and healthy for you, try and embrace them. Make sure that you respect your own boundaries and that you make sure that you have solid boundaries and rules up with everybody so that everybody knows where they stand with each other. But you have no right to go squirreling around somebody else's backstory, somebody's past, somebody's diagnosis. You do not owe anybody an explanation of your personal medical details or your past trauma. You should not have to provide an example of a diagnosis for people to take you seriously. Nobody else would expect that with any other disorder. You are valid as you are. Don't let anybody else tell you otherwise, not even yourself. Okay, I think that about sums it up. But before I go, I have a little announcement for you. If you haven't heard already, you should check out tickets below to the Entitled to Life conference, which is happening in San Francisco this November. It's happening on the 6th and 7th. It's a 2-day conference specifically about DID and OSDD. We are going to be guest speakers there, along with Multiplicity and Me, Jeremy and Alternate Perspective, now known as Team Pinata, the Labyrinth System, Fragmented Psych, and the Entropy System. It's going to be an amazing gala. You have the chance to meet us in person if you'd like to. It's going to be a super inclusive and incredibly safe experience. There's safe rooms and everything you could possibly need, and it's being very, very well put together, and we can't wait to see you there. Don't forget to check out tickets below, or you can watch the video we made about it up here. Thank you for watching. Lots of love, everybody. Bye.